given me one of the greatest gifts of my life. And I have tremendous gratitude to him. Always.
Is being a mother different than you expected? What is it like?
It's the most wonderful, and it's the most difficult thing that I'll ever do in my life. Nothing that I've done, including training to become a doctor, is as difficult. And nothing has given me as much joy. Like, nothing. Like, on the deepest levels.
What kind of medicine is it that you practice?
Family medicine.
Cool. How long have you practiced for?
15 years, no, 15 now. 1996 was when I became fully qualified. I was coming to Seattle, and so my sister and I went down there to see him twice, I think. Once in Portland, once Seattle. And then haven't seen him in a few years since then because he hasn't come this way. But the last time I saw him, one thing that I discussed with him, which was a last-minute thing on the way out at my sister's encouragement, was that I wanted to have a baby. And my husband had a vasectomy, I don't know, like about 9 years ago, and we tried to reverse it, and it wasn't successful. And we'd already been for IVF consultation, and twice I delayed having the procedure. And then we went to see Dr. Naram, and on the way out I mentioned it because my sister said, "Why don't you talk to him about it?" And my husband wasn't even there, and he gave me some herbals for him as well. And he, I think, was only going to give me a few of them, I guess. And Miriam was there, and she said, "Give her all of them," like for her husband, give them all of them. And so then he checkmarked off a few more things, and he looked me in the eye, and this was important, I knew, I could tell, and he said, "You must wait 3 months before you try to conceive." And I knew it was significant, and so we did. And almost right at the 3-month point, we were on vacation in Europe, and we were both relaxed and you know, just relaxed and feeling good, and so we tried, and I know the moment that she was conceived. I know. And now she's 2 years old. 2 years and 3 months now. And she's wonderful. And I'm so happy. We're so happy. She's like our miracle. There's something about him. I trust him. He has my full faith as a result.
So beautiful. For other parents who are, other couples that are having some struggle, and they're used to, you know, other things, they're not used to this. What advice, or how would you describe this to them, or what advice would you give them about Dr. Naram?
Well, it's funny because I am a medical doctor, so I refer people for IVF occasionally, and it's varying, those medicines, those hormones. I don't think it's good for your body.
Yeah.
Like, I'm so glad I did not have to do that. And sometimes when I feel comfortable, when it's someone who I feel might be open, and that has happened twice now, I actually tell them about Ayurvedic methods. And it's hard for me to share my own personal experience sometimes in that setting, because sometimes it's like I feel it might not be that professional, and it's such a personal thing, and it always makes me weepy, and I'm just not comfortable doing that yet. So I do share that it has helped me in many ways, and that I know that it works. And then I tell them about Dr. Naram. Like, I would love to be able to say to everyone who is having difficulty having children or any health matter that this works, and I know it works. I know it works because my daughter is living proof that it works. You can very much integrate this into your Western medical practice. You can do that. There's nothing preventative really in Western medicine, the way Ayurveda is. It will stop disease before it happens. It prevents disease, and it sees where you're going. It sees the path you're on before you get to the end sick destination. Nothing in Western medicine really does that. So if we could do that,